The next drug we'll be looking at is the primaquine. All right, so we'll be looking at the pharmacology of this drug, primaquine. So you can see that the primaquine, from looking at the picture, you can see that they actually drew a mosquito on it. All right, to just obviously tell you that this is what an anti-malaria drug. Okay, so for primaquine, we'll be discussing it. We'll look at the pharmacology, mechanism of action, route of administration, pharmacokinetics, side effects, contraindications when you shouldn't use this drug, and every other thing that is involved. Okay, so for primaquine, you say that it's an anti-malaria medication. All right, it's used to treat and prevent malaria. Okay, anti-malaria medication. Okay, it is also used to what? Eliminate liver stages of Plasmodium vivax and Plasmodium ovale. Right? So you eliminate the liver stages of these organisms as they are growing. Mechanism of action is it actually interfere with the parasitic mitochondrial function. All right? So it interferes with the parasitic mitochondrial function. It inhibits DNA synthesis. Right? Spectrum of activity. It has action on what? Um, different malaria disease like Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae. Okay, has effect on all of them. Route of administration is through the oral route. Okay, dosage, if you are treating, that's the person already has malaria, treating it is about 15 to 30 milligrams per day for about 14 to 21 days. That's 2 weeks to 3 weeks. Then prophylaxis is like you're trying to prevent. Okay, still 15 to 30 milligrams. Okay, but that one is per week. Right. Pharmacokinetics is its absorption is what? It is rapidly absorbed. Distribution is widely distributed in the body. Metabolism, hepatic metabolism with renal excretion. Elimination half-life is what? About 4 to 6 hours. Okay, in the body. Then the side effects of this drug, the patient will complain about wanting to vomit if they are taking this drug, or they might be vomiting. All right, there might be diarrhea, abdominal pain. Then those ones are the common side effects. Right, then looking at the serious side effects, it could result into hemolytic anemia, and this is mostly in people that are deficient of the glucose 6 phosphate dehydrogenase. Right, so if the patient is already deficient in this glucose 6 phosphate dehydrogenase, you shouldn't use this type of drug, because it will now what? Precipitate anemia. Okay, it can also cause Methemoglobinemia and agranulocytosis. Right, contraindications, so that's in patients where you shouldn't use this drug, is patients that are already deficient in what? Glucose 6 phosphate dehydrogenase, don't use it. For patients who are pregnant, okay, don't use it. For patients who are currently breastfeeding, don't use it. Okay, then drug interaction, they may interact with other medications such as what? Quinine, chloroquine, and sulfonamides. Right? So that's it for the pharmacology of this anti-malaria drug.